Good morning. The Senate Committee on Health, Education, Labor, and Pensions will come to order. Today we're voting on the Pandemic and All Hazards Preparedness and Advancing Innovation Act, which has been led by Senators Burr and Casey. I know there are other bills that senators would like the committee to consider, and my plan is to have a markup at the end of June. I'm hoping to do that on June the 20th. There are many bills we could vote on June the 20th if we reach agreement on the language, which will take some cooperation and compromise. Hopefully we can apply Senator Enzi's 80-20 rule. If we can agree on 20% of it, we can get the other 20 sometime later. These include the bill that Senator Enzi and Casey are working on developing a trained, skilled, educated workforce. Senator Scott's bill to advance research on sickle cell disease. Senator Bennett and I are working to reintroduce the PREMIE Act. Senator Collins has legislation to try to improve tracking of dementia and Alzheimer's. Senator Murray would like for us to vote on Senator Heitkamp and Senator Capito's legislation on maternal mortality. Senator Collins has legislation to prevent private insurance plans from prohibiting pharmacists from telling patients about cheaper drugs. I think Senator Cassidy may be involved in that as well. Senator Young's bill would use predictive analytics to help children and families, especially those impacted by the opioid crisis. Senator Thune's bill on sports medicine licensure. These are all important pieces of legislation, and again, we would hope to mark them up on the 20th, but it'll take some cooperation and compromise between now and then to do it. Today, Senator Murray and I will each have an opening statement, and then I will welcome Senators Burr and Casey, who are the sponsors of this legislation, to speak on the bill. We plan to vote at approximately 10:30. There'll be one roll call vote, and I'm happy to stay after we vote if there are other senators who still wish to speak. I see Senator Baldwin. After Senator Burr and Casey, I want to give you a chance to speak to your amendment, and Senator Burr a chance to respond to that before we vote, if we can do that. We have seen in recent years the need to be prepared when a public health emergency strikes: Ebola virus, 3 consecutive hurricanes last fall. This act authorizes programs that protect Americans from 21st century threats, including natural disasters, bioterror attacks, infectious disease outbreaks like a pandemic, flu, or Ebola. Senator Burr, who authored the original legislation in 2006 and led the first reauthorization effort in 2013, along with Senator Casey, have again worked hard on this bipartisan legislation. It is unusual for United States senators to have that much history with a single piece of legislation over the year, and Senator Burr and Senator Casey, I congratulate you for that work. This legislation includes priorities from many members of the committee, including Burr and Casey. I and Murray worked with Senator Baldwin to include specific provisions for the Biomedical Advanced Research and Development Authority, BARDA, which is responsible for advanced research and development of medical countermeasures like vaccines or treatments to support pandemic flu. We'll continue to discuss ways in which we can further the good work at BARDA and HHS on pandemic flu as we move to the floor. Provisions from Senator Cassidy's Good Samaritan bill, championed by Representative Blackburn in the House of Representatives, to clarify liability protections for volunteers during public health emergencies and improve the Public Health Emergency Fund. We'll continue to work on that as we move toward the floor. Senator Roberts has a provision to create an expedited pathway at FDA for animal drugs. Senator Smith and Young have provisions to improve considerations for animal health. Senator Scott, policies to help advance genetic editing technology. Senator Collins' bill, creating a National Advisory Committee on Seniors and Disasters. Senator Isaacson's bill, Mission Zero, establishing a program for military trauma teams to provide care at trauma centers while still enabling them to be deployed on military missions or for public health emergency responses. The bill helps make sure we can respond to future threats by modernizing the Centers for Disease Control Prevention's biosurveillance capabilities, by authorizing the Public Health Emergency Medical Countermeasures Enterprise, by reauthorizing the National Strategic Stockpile, which buys and stores the medical countermeasures we need, reauthorizing the Hospital Preparedness Program and Public Health Emergency Preparedness Agreements to support hospitals and public health departments on the front lines, Reauthorizing BARDA, that supports research and development on medical countermeasures. Reauthorizing Project BioShield's Special Reserve Fund through 2023 to demonstrate the United States is a committed partner to develop medical countermeasures for which there's no commercial market. Making sure BARDA has flexibility to address significant threats, including diseases that could become a pandemic, like the flu, or diseases resistant to antibiotics. I want to add a note on timing. It is important to reauthorize this legislation before it expires in September. So my hope is we can approve the bill today so the Senate can quickly consider it. And I want to thank not just Senator Burr and Casey and Murray for their work on this, but their staffs have really worked hard and in a very professional way on this and produced a bill that I think the committee and the Senate can be proud of. Senator Murray.